Knock, knock.
Deep in the throes of another COVID surge comes a shot of confidence in the vaccines.
Those who've been waiting for full approval should go get your shot now.
Using data from 44,000 clinical trial participants, the FDA has given the Pfizer-BioNTech vaccine full approval. 92 million Americans are already fully vaccinated with Pfizer, but there are still plenty of skeptics.
Where does full FDA approval fit on the spectrum of helping convince people to get vaccinated?
Unfortunately, I think full FDA approval does not fit high on the spectrum for individuals. I think it does fit high on the spectrum for large organizations, employers, states, cities, and local jurisdictions to put in a mandate.
Within minutes of the approval, New York City announced it would require all teachers and school support staff to get the jab. The Pentagon confirmed a mandate for all members of the U.S. military.
These efforts ensure the safety of our service members.
It comes at a critical juncture in the pandemic as cases and deaths surge again. Doctors in Florida say they're at the breaking point.
The heartbreak now is we're not just going into work and working long hours, but we're seeing people who don't need to be in the hospital, who are healthy, who are young.
Through mandate or motivation, FDA approval will lead millions more to get vaccinated, while raising questions about when vaccine coverage will be expanded.
I think what people are focusing on is when are children between the ages of 5 and 12 going to be vaccinated?
There's no timeline for approval in young children, even as they head back to school. Other vaccines, like Moderna's, are still under FDA review. FDA approval may help shake the perception these shots are experimental or untested at a time when they may be more important than ever. Jackson Prosco, Global News, Washington.
A new vaccine mandate for New York City public school educators. Mayor de Blasio announcing that all New York City public school teachers, principals, and staff will need to be vaccinated.
He set a deadline. Employees will have to have received at least one dose by September 27th. Eyewitness News reporter Stefan Kim is live on the Upper West Side with details. Stefan.
Well, Candace and Ken, it is the first blanket vaccination mandate for a class of city employees, and it would apply to nearly 150,000 school employees, including contractors who work inside schools. And as you mentioned, they will have to get at least the first dose by September 27th. The previous requirement allowed for weekly testing for the unvaccinated with unpaid suspensions for workers who did not comply. That, of course, is no longer the case. At least 63% of school employees have already been vaccinated. That's actually higher than the percentage of New Yorkers overall who've been vaccinated, and that figure doesn't include those who may have gotten their shots outside the city.
We're going to start immediately working with labor unions. I spoke to the leaders of the key unions over the last few days, and we're going to start bargaining with them immediately on the impact of this decision and how to ensure we can implement it properly and fairly. We're going to work together. They'll all speak to this decision and offer their own views. But what there is clearly a willingness to do by all parties is sit at the bargaining table and figure out what this means and what the ramifications are.
Now, in a statement, the head of the UFT says while the city is asserting its legal authority to establish this mandate, there are many implementation details, including provisions for medical exceptions that by law must be negotiated with the UFT and other unions, and if necessary, resolved by arbitration. The school principal unions adds that these requirements are subject to the collective bargaining agreement. The first day of school is September 13th for the city's roughly 1 million public school students. And of course, this move comes as parents are anxious as positivity rates are on the rise.
Even though the Pfizer vaccine now has full FDA approval, some Americans are still saying no to mandatory vaccinations. Some are also counting on unemployment benefits while they look for a new job that doesn't require vaccines. So the Verify team asked if your employer requires proof of a COVID-19 vaccine and you are fired for refusing, can you be denied unemployment benefits? Where our team went to two sources for answers. John Harrington from the Employment Law Group and Daniela Urban, Executive Director of the Center for Workers' Rights in Sacramento. In most areas of the United States, including California, if you are fired for breaking a company policy, you are not eligible for unemployment benefits and payments. Here's what we found. Unemployment payments are given to Americans who lose their job through no fault of their own. Employment attorney John Harrington explains someone fired for breaking a company policy, big or small, can be denied benefits. Here in California, the question comes down to if refusing to comply with an employer policy requiring the vaccine would be considered, quote, misconduct. According to the Center for Workers' Rights in Sacramento, it is likely that EDD and the California Unemployment Insurance Appeal Board will determine that in most cases it is indeed misconduct and employees will not be qualified for benefits. So we can verify that in most states, including California, you can be denied unemployment insurance benefits if you are fired for refusing a vaccine required by your employer.
The U.S. government announced on Wednesday that it plans to make COVID-19 vaccine booster shots widely available to fully vaccinated individuals 18 and over starting September 20th. The move comes as COVID infections are on the rise in the U.S. due to the Delta variant, and data shows diminishing protection from the vaccines over time. U.S. Surgeon General Dr. Vivek Murthy.
We are concerned that this pattern of decline we are seeing will continue in the months ahead, which could lead to reduced protection against severe disease, hospitalization, and death. If you are fully vaccinated, you still have a high degree of protection from the worst outcomes of COVID-19, severe disease, hospitalization, and death. So we are not recommending that you go out and get a booster today.
Americans who have completed a 2-dose inoculation of the Moderna or Pfizer-BioNTech vaccines at least 8 months ago will be eligible for the 3rd dose. But those who received the single-dose Johnson & Johnson vaccine will have to wait on a booster for now, as more data is expected in the next few weeks. Top U.S. health officials said in a joint statement that booster shots initially will focus on healthcare workers, nursing home residents, and older people, among the first groups to be vaccinated in late 2020 and early 2021. According to CDC data, more than 72% of Americans 18 and older have received at least one vaccine dose, and nearly 62% are fully vaccinated. In recent weeks, several other countries also have decided to offer booster shots to older adults, as well as people with weak immune systems, including Israel, France, and Germany.